Oh, Um, Hello, my name is Greg Robinson. I am the Director of Public Policy for the Autistic Self-Advocacy Network. Thank you for joining us today. Today we're going to be talking about Olmstead, home and community-based services, and a number of other policies around community living, how they all fit together and why they're important and what we can do to protect them in this moment. So to start off, let's just go over the policies that we're going to be talking about today. Um, the first is we'll be talking about the Olmstead versus LC decision, which is a really important court case that um, established that we have a right to live in the community. Then we'll be talking about home and community-based services, what those are, how they're provided, and why they're important for community living. We'll also be talking about um, another law called Section 504 of the Rehabilitation Act, and then the integration mandate, which is also part of the law and is interacts with those other laws in a way that is really important for um, what the government is supposed to be doing to protect our rights to live in the community. So as you may have gathered from my descriptions, all of these policies work together to protect our rights to live in the community, to get services in the community, and to have our rights respected in the ways that we live in the community. So we'll talk about those connections and we'll talk about some of the threats to those policies as we go forward. So let's start off with the Olmstead decision. Olmstead versus LC, or the Olmstead decision, is the name of a Supreme Court case from 1999. Olmstead, it's often called Olmstead for short, which is a little unfortunate. Olmstead is the health commissioner, the name of the health commissioner who was keeping two women in institutions in Georgia. He was the one being sued. Um, Louise Curtis and Elaine Wilson, the two women who sued, were self-advocates who were being kept in institutions. They didn't want to be. They had doctors and supporters who all agreed that they could live in the community if they had the right supports. And the problem they were having was they were being institutionalized because that was the only way Georgia would give them supports. Their doctors and nurses and care workers and supporters all said these, these women don't need to be institutionalized. They would get discharged, they wouldn't get supports, and then they would get institutionalized again. Um, so that after that happened a bunch of times, Curtis and Wilson sued the state of Georgia and Georgia's health commissioner um, because Georgia wasn't giving them the supports to live in the community. They said that was discrimination. And that as self-advocates, as making these arguments, they really played a critical role in establishing these rights for all of us. So it's again kind of unfortunate we often lose track of Lois Curtis and Lane Wilson's names when we talk about Olmstead, because they were really the heroes of this story more than anything. Um, so in the Olmstead decision, the result of the Olmstead decision, this went to the Supreme Court. The Supreme Court said yes, the Americans with Disabilities Act says that people with disabilities, it's discrimination to force people to be in institutions in order to get supports. That people have the right to choose to live in the community as long and that they shouldn't be forced to be institutionalized if they can get their supports in the community. And we're of the opinion that with the right supports, anybody can live in the community. The Supreme Court did set this sort of 3-point test for when um, people should be allowed to live in the community, and one of them was if their supports can be met, if there was a way to get the supports that they needed in the community. So it is important to just name that because there is the Supreme Court did put a few conditions on that, but we also firmly believe that with the right supports, anyone can with the right supports live in the community, and if they want to, they have that right. Um, so what Olmstead means is that people have the right to get services in the community if they want it, and it is possible to meet their needs. Um, After the Olmstead decision, advocates have advocates, including self-advocates, including protection and advocacy organizations, have been able to use Olmstead to make sure states came up with plans to support people living in the community. Sometimes that happened because advocates sued states to make them follow the ruling. And a lot of states have what are called Olmstead settlements, where they agreed to a plan to support people living in the community. Um, Sometimes those plans include stopping states from things like sheltered workshops without other supports. Some states, that's part of the plan. Um, at the same time, even now, there's no state that has like full community integration of everybody who wants to. We still have a lot more work to do to make sure that that right is something that we all have. So that fight's not done. It's still very important. We know that there are people who could live in the community with support and don't have those supports and are off, often in institutions or um, group homes or other settings that they may not want to be because they don't have the supports. And we really just need to still work to make those changes so that everyone can get the supports they need. Um, which leads to the next thing that we want to talk about, which is home and community-based services. These are the services that people get in the community. These are typically usually provided by Medicaid. Medicaid is the main payer for community-based services, home and community-based services. And these are services that help people with disability, that give people with disabilities the help they need in our daily lives while we live in the community. So some examples of what this can include help getting around, help with transportation, help with cooking and cleaning, including help cleaning with people who some people need help cleaning themselves, some people need help cleaning their homes. It includes support workers and in-home helpers. It includes medical care, including in-home health aides. It can include support for work. Um, it can cover a lot of things, and this is all work that usually involves support workers providing the support on usually a one-on-one sort of situation, but it's very specific to what people need to meet their needs, their basic needs to live in the community. So it can cover a lot of things. There's some things that aren't even on here, like some states, this is all controlled by the states, but some states there's even um, options to help um, with some things around housing, like accessibility or with housing searches. But a lot of it is just each state. There's some essential things that are covered, but then there are some things that each state does different things with the HCBS program. Um, so HCBS is very important for us to live in the community. Most HCBS comes from Medicaid. Almost all of it does. Medicaid is a federal program. Um, it's a program that's shared by um, run both by the states and the federal government together. The states come up with their HCBS plans, and they share those plans with the federal government. The federal government approves the plans, and then the federal government also has to make sure that the states are following their plan and also the other rules for Medicaid. Medicaid has a lot of rules about what people need to do, what people need to report. A lot of these rules are to protect people who get Medicaid or get services from Medicaid, and it's very important here. One of those rules is what's known as the settings rule. Um, the settings rule, it's also called the HCBS rule, because what this rule basically does is it says who can get HCBS, um, uh, where people, based on where people are living, because Medicaid covers home and community services, services that people are getting in the community. If people aren't in the community, they're not supposed to be getting HCBS money. There's other Medicaid programs that might cover them, but it's very important that people who are in the community are not in institutions. Those are different things. Um, so the settings rule says what setting counts as an institution. So is a group home an institution? Is an apartment situation an institution? These are questions that the settings rule tries to answer. And part of answering that is who can get money for HCBS. If a provider also owns an apartment, can they get money for providing HCBS? And the answer to that is really interesting. What they did, instead of saying, oh, you know, it's an institution if it has a certain number of beds. What they instead said was it's an institution if it's like an institution, if people can't control whether they can come or go, whether they have privacy, whether they can get up in the middle of the night and have burrito, whether they can have guests over, whether they can go out in the community on their own or not choose not to go out in the community if they don't want to. Um, those are what makes something an institution or not. So part of the rule is saying these are the rights people have if they're getting HCBS. And these are rights that every provider of HCBS needs to make sure that they are respecting. Um, so all those things I just talked about, the ability to come and go, the ability to control whether you have guests, when you eat, those are all part of the settings rule. It's a really important rule for protecting our rights. Um, so um, next, we'll talk a bit about Section 504. Section 504 is a part of a bigger law called the Rehabilitation Act. This is the first disability rights law in the national disability rights law in the country. It's a very important law. Section 504 is a part of the law that says places that get money from the government can't discriminate against people with disabilities. Um, so a lot of places get money from the government. Some of them are schools get money from the government. Almost all doctors, any doctor that takes Medicaid money or Medicare money, workplaces, government buildings, all of them um, are covered by Section 504. Section 504 is also a pretty old law. This was passed in the 1970s. Um, it took a while for us to get sort of when a law gets passed, the executive branch of the government has to make rules that say how they're actually doing the things that the law says they have to do. And there was a lot, some of the most important early disability rights activism was pressuring the government to make 504 rules. Um, Now, those rules are very old. So that was like 40 years ago, 50 years ago now. Um, so they were overdue for an update. And in last year, the government did make finalized new rules that updated Section 504. It updated them to make sure that they protect people with disabilities from discrimination in healthcare and human services, which is most 504 applies to all parts of the federal government and all parts of federal funding, but a lot of where this work comes out of is the um, Health and Human Services Department. So healthcare settings, they kind of set the tone that the rest of the government then follows with these rules. But every part of the government then has its own rules that it either has made or is going to make to reflect this across the government. Um, so the new rules that the government made in the past year, um, it added new rules to help better protect people with disabilities from discrimination in healthcare. These are updates to the rules that had been used, and those updates, they did those updates for a lot of reasons. One is a lot has changed in the past 50 years. We have new disability rights laws like the Americans with Disabilities Act. Um, there's a lot of things we found out are problems that were not spelled out as like how the government should handle this. So a lot of this, they spent a lot of time asking the community what they needed, what needed to be included. They spent a lot of time thinking about like what did they need to make sure was in here. So one thing they included was they said that doctors, hospitals, and insurance companies can't say that people with disability can't say no to giving people with disabilities life-saving care just because they're disabled. They can't say, oh, well, because you're disabled, your life isn't as important, so we're not going to give you the care. This is a problem that we saw during the COVID pandemic in a really big way, was that some doctors and hospitals were just saying that people with disabilities were not as big a priority because um, they said our lives didn't matter as much, that we, the quality of our life wasn't as good, and so we got denied care in some cases. Um, that was a problem, and because the government saw that was a problem and we needed a better rule to make it clear that they can't do that, that was included. They also have new rules for making sure that machines that do tests like x-rays are accessible so that we can like get that, so that they're able to perform tests on us, they're able to perform weighings on us, things like that. Um, they also make sure that the government services that protect children don't discriminate against children or parents with disabilities. So this can take a lot of different forms. One is, when people are in foster care, they may experience discrimination. There's cases where people maybe may experience restraint or seclusion. They may be um, harmed because they have disabilities. And at the same time, there's also a real risk that um, parents with disabilities are not respected as parents or seen as capable of taking care of their children. And there have been cases in the past where people have had their children taken away from them. And this rule says that is discrimination if there's no other reason for it other than someone's disability. Um, the other thing that we're going to talk a bit more about is that it also updates 504 to match the Americans with Disabilities Act. As I mentioned, the Americans with Disabilities Act is a more recent law. It was passed in the 1990s, and it includes a definition of disability. That is the definition of disability we use pretty much everywhere. It is also everywhere related to disability rights. It also is the thing that Elaine Wilson and Lewis Curtis sued under, was the Americans with Disabilities Act. So when they got the right to live in the community, the Supreme Court said that's because of the Americans with Disabilities Act. It says that they have to have that right. So one thing that they were updating with 504 is making sure that 504 was saying the same thing as the Americans with Disabilities Act. Um, so what does that mean? It means so there were one piece of that was that Section 504 also, we're going to talk a bit about the integration mandate. That was one thing that got added to the 504 rules because that's part of the Olmstead decision. That's because of the Olmstead decision. The other thing is the 504 rule had an introduction, and the introduction for rules like this, they talk about what the law is and what's changed over the past since they had to start making this rulemaking, what's changed that they need to think about when they make the rule. Um, One of the things they talk about is gender dysphoria. And they say it can be a protected disability under 504. They say this. because there was a court decision um, that said this. And they were saying that court decision is still the law, and we agree with that decision. That was in the introduction. It was just saying this is the law as we understand it. This is something we need to think about as we're making this rule. Um, Gender dysphoria is a feeling that some transgender people have where their bodies don't match how they feel. And it is a term that doctors use that is part of a diagnosis that people get given so that they can get healthcare. Um, it is, for many people, it's a very important part of how they can get healthcare. So it is very important. It's an important part of having access to healthcare. Um, this court decision said that there are times where gender dysphoria is a disability and that some people can, in some cases, sue for disability discrimination if they um, are denied access to that care. The 504's introduction agreed with that rule and agreed that that's the law, as I said. So we'll talk a little bit more about that in a second because it is important for what some of the challenges to 504 we're looking at right now. But the other thing that I mentioned was part of the 504 rule is the integration mandate. The integration mandate comes from the Olmstead decision. Um, After the Olmstead decision, the federal government said, okay, make we have to explain what this means to the government so that we can make rules and laws that follow the law. And what the Department of Justice, part of the government, said was the integration mandate says that people have the right to get services in the most integrated setting appropriate to their needs. So that's the integration mandate. That's the definition that's used for it. And that says that state and local governments have to make sure that people are offered options for services in the community, and that when the federal government makes new rules, they have to keep that in mind with the rules, and they have to make sure that they're supporting the ability for people to get those services in the most integrated setting. That all comes from the Olmstead Decision and the Americans with Disabilities Act. One of the other things the 504 rule did was add the integration mandate to Section 504. As you may remember, Section 504 is much older than the Americans with Disabilities Act and much older than the Olmstead Decision. So the rulemaking said, well, this is all the law. We need to make sure that what we're doing with 504 matches the law. And so we need to have rules for what integration means for Section 504. So just to recap, the Olmstead Decision says that people with disabilities have the right to live in our communities. The Olmstead Decision also established the integration mandate, which is the federal government explaining what that means to the federal government and making rules for it. Home and community-based services are the supports that we need to live in the community. So those are the daily support services that we use to live in the community. The federal government has rules for how people get HCBS, home and community-based services. They have rules that are there to also protect our rights. And then Section 504 says places that get money from the government can't discriminate against people with disabilities. So taking together, all of these protect people's rights to live, work, play, and be in our communities. They all fit together. So attacking or getting rid of any of them would make it a lot harder for the other two to work. And that also means attacking or getting rid of Medicaid funding will weaken all those policies. Medicaid is, like I mentioned before, the main way people get HCBS. So if we don't have that, then Olmstead even if it gives us a right to live in the community, if we don't have the supports, it'll be very hard to do that. Um, Also, and now we'll talk about why we went through what's in Section 504. Section 504 is currently under threat from a lawsuit, and we'll talk a bit about that. Um, so, the lawsuit against Section 504. In September of 2024, so this past September, 17 states started a lawsuit. When they sued, it was called Texas v. Becerra. Now it is called Texas v. Kennedy. That's because they sued the federal government, and when they say who they're suing, that included the Secretary of Health and Human Services. That used to be Secretary Becerra. Now it is Secretary Robert F. Kennedy. So the name of the lawsuit changed, but it's the same lawsuit. They're suing, they sued to try to get rid of Section 504. That lawsuit's still happening. They they said that they sued, they asked for a few things. One of them was that they said all of Section 504 is unconstitutional, you need to get rid of it. They also sued saying that the language in the introduction that says people um, with gender dysphoria can have their rights protected as having a disability. Um, they said that they wanted to get rid of that. They also sued to get rid of the integration mandate. So those are all parts of the lawsuit. They asked for all of those things. Um, when um, Obviously that's very concerning to our community. We and a lot of our other allies in the space made a lot of you in the audience, a lot of our advocates raised a lot of noise about this, and a lot of the states said, "Oh, when people pointed out that they were asking to get rid of 504, they're like, oh, well, we don't really mean that. We just want to get rid of." Um, the gender dysphoria part of the introduction. They said that's the only thing we want to get rid of. Really, we're not really after 504. But they did sue. They said we want to get rid of Section 504. So for whatever reason, these states decided that saying they only wanted to get rid of the rights of transgender people and not anything else, they thought that was a better argument with the public. Um, I do want to add, I do have there are a couple of updates on this. At a more official sort of update on where the lawsuit is, they did say that they don't want to sue over the constitutionality of Section 504 anymore. So they are saying now that they don't necessarily want to get rid of all of 504, but they are still suing over the integration mandate. So we the suit hasn't gone away, but they are, I think, because of a lot of the pressure that they've gotten from you and us, they are trying to change their tune a bit on the lawsuit. Um, but it's still a very bad suit, and it still can really hurt us. Um, right now, the federal government um, also put out an update. They said that the introduction isn't really part of the rule and it isn't enforceable. The states are still suing over the rest of the rule, including that. So that part hasn't gone away just yet. Um, and I think we're still waiting to see what states do in response to what the government is saying. That isn't really part of the rule. That was just something in the introduction. But they are still suing over the integration mandate too. So it is bad enough that these states want to take away civil rights for transgender people, but they are also still attacking Section 504, still attacking our rights to live in the community. And, you know, even with that status update, it is hard to know where these types of lawsuits go. And they may still try to get rid of all of Section 504. So we can't say that that part's over either. Um, we um, so we need to keep at this. One thing that you can do to take action on Section 504 is um, we are going to list the states that are still part of the suit. And if you live in one of the states, you can call or email your attorney general, your state attorney general, tell them, give them your name, let them know that you're one of you're a voter in the state. You can say why Section 504 is important to you and your community, why the integration mandate is important to you and your community, and that you want the attorney general to drop the lawsuit, um, and tell them why. Tell them what it means to you to be able to live in the community, and tell them why Section 504 is a really important part of protecting your rights. Um, if you live, if you are in one of the states that's part of the lawsuit, there may also be other self advocates and disability right groups who are part of this work and are already working to stop the lawsuit. This is the sort of work that goes best when we're all working together, and when we all know when we all agree on what um, we need to say to strengthen each other's voices. So it is really, really valuable if there are other folks in your state doing this work to connect with them and figure out the best way to work together. You can talk to your Center for Independent Living or your ARC chapter. That can be a good way to find out who's organizing in your area. There's also selfadvocacyonline.org, which lists self-advocate organizations on a state-by-state um, basis. So here are the states that are part of the 504 lawsuit right now. It's Alaska, Alabama, Arkansas, Florida, Georgia, Iowa, Indiana, Kansas, Louisiana, Montana, Missouri, Nebraska, South Dakota, North Carolina, Texas, Utah, and West Virginia. I apologize to anyone from those states if I didn't pronounce it correctly your local uh, to the local dialect, but those are the states. I'll leave this on the screen for a minute for folks to get that down. But if you are in any of these states, you have a chance to reach out to your attorney general and ask them to make the right choice to protect the rights of people with disabilities in their state. Um, Next, we want to talk about a couple of other threats to community living and the integration mandate. Um, these are other policy things that are happening in policy right now that um, are other places where it's really just valuable for us to work together to fight back. There are right now, the Senate is considering some very big cuts to Medicaid in the budget. They are talking about these cuts in a lot of ways. They are saying that they're not cuts. They are. All of them are cuts. They are saying that they want to protect Medicaid for the really vulnerable, but nothing they're suggesting will protect Medicaid. All of it will make it harder to get, harder to use, and force states to make even bigger cuts to Medicaid. And we know that the programs that will force states to cuts are the programs that we depend on. So we don't want any of these cuts, and we are really encouraging folks to talk to folks in the Senate about how these cuts would affect them. We also, the Secretary for Health and Human Services, Secretary Kennedy, has often made statements that are untrue or incorrect about um, people with disabilities, about autistic people, about community living, about vaccines. These also harm us. They harm our ability to live in the community. They harm our ability to, um, I think a lot of us are have, and yeah, another place where we really need to make sure that we are pushing back on false statements that are coming out. Um, there are also policies that are, there are also often policies that want to put more money into institutions and take money away from the community. There are suggestions that um, we need to put, suggestions that um, putting people who have trouble finding housing in institutions, or that they're or that we don't make it, or that it's we aren't putting enough Medicaid money into mental institutions. Those are policies that people propose, and that we also need to fight back against in order to make sure that we have the resources we need to live in the community. And then the last thing is there's also um, a different budget proposal. This is a budget proposal for just next year, as opposed to the Medicaid cuts, which are looking at the next 10 years. But the president has put out a budget proposal that wants to change the administration for community living. They want to get rid of it as its own agency. They want to put it into a different agency, and they want to give it less money, and take away some of the programs that the Administration for Living does that make it, that are an important part of supporting the our ability to live in the community. So they want to get rid of the university centers for developmental disabilities, and they want to get rid of what are known as projects of national significance. These are studies that look at how we're, these are projects that do a lot of things that are very important, but one of them, for example, is a study that looks at how um, Medicaid money gets spent and um, how it's supporting community living, and uses that information to um, help people who want to change policy to make those better. But we need that information out there in order to do that. So it's really important work. Um, so why these threats matter. These are all threats to community living and the integration mandate, that can cause problems for people with disabilities. They can cause us to lose our supports. It can cause us to lose Medicaid coverage entirely, which includes our supports, but may also include our other healthcare that we rely on. If states have less money to, um, if states have less money, they may also not be able to um, pay providers. So we may lose providers. And ultimately, without the supports that we need, without providers, without um, any ability to get the services we need in the community, there's a real risk of people with disabilities being put in institutions. If That's why I mentioned when we talk about Olmstead, the important thing that the Supreme Court said is if we can get the supports in the community, that has to be an option. But if we can't, because those supports don't exist, um, then there's a real risk of us going back to those bad old days. Um, so I know that can all be very scary. And I want to emphasize that this is where things are right now. It is a threat. These are threats. They can be very frightening. People have the right to be scared and the right to be angry, but this doesn't mean that we've lost these rights. This means that we need to take this time to fight back. So I think I always struggle with, like, I don't want people to panic. I don't want to fearmonger. I think in this case, these are very real threats, that we have a chance to fight back against and need to take that chance, and do what we can to protect our rights. Um, so what we can do around those things. You can call Congress and ask them to protect Medicaid. That's one of the most important things in this moment, I think, that we can all do. Um, we have guides on our website to help people, to help talk you through how to contact your member of Congress, who you should be talking to, um, what um, what you need to know about Medicaid, what's happening with the budget, some things that you can use to help you script what you want to say. We also have action alerts. You can sign up for our emails, and we can share those with you. Um, just these include some updates on where things are. We put out resources in plain language, and can let you know when there's an important vote that it's a good time to talk to your member of Congress. Um, we aren't the only ones doing this work either. You can also find self-advocates in your state that are doing work to protect disability rights. There is also work to be done in your states. Um, your states are the ones that decide what goes into HCBS. They decide what goes into the waivers. They decide how they're doing those things. So your voice is really important there too. And so that's the other thing you can do. You can work with self-advocacy groups in your state to protect disability rights. And again, selfadvocacyonline.org has a list of self-advocacy organizations in your state that you can connect with. And I think with that, that is my overview. I can now pause and open things up for questions if anybody has any.
Awesome. I think we can take the slides down and folks can feel free to put their questions in the Q&A box. And it looks like we have a few, so I will read the first one. How does the proposed Medicaid cuts apply to the Olmstead decision and Section 504?
Okay, so that is a good question. These are a little distinct, but I did start to talk about this a little bit. The Olmstead decision is very specific that we have the right to choose to live in the community if our if our needs can be met with supports we can get in the community. Um, the problem is that there's no law that says exactly that states have to provide home and community-based services. Um, and if the Medicaid cuts happen, because the law doesn't require states to pay for home and community-based services, they don't need to give home and community-based services to everybody who needs it. So what can happen is that states may say, well, we have to cut money somewhere. We're going to eliminate this because we don't have to pay for it. And that is one way that the Olmstead decision, our ability to live in the community would be impacted by it. We would have the legal right, but without the supports existing, that wouldn't really amount to much. Um, Section 504 is, I think, a little different because that is a really broader rule about like what anyone who gets money from the federal government has to do. It is true that I think Medicaid cuts, if we see hospitals close, if we see doctors lose Medicaid funding, we may have a harder time getting our rights protected in healthcare settings. Um, I think that's a little indirect, but that I think is the best answer I can give on that.
Thank you. And then, sorry, what are some of the sources you use to stay on top of disability-related news? My friend and I try to keep track of what's going on, but none of us are particularly satisfied with our news sources.
That is a really good question. I can speak professionally here as somebody who does disability policy. I try to get a range of sources, which is sometimes a lot of work, but there are. I think you're right that there's like no good one source. I think for a lot of the work I do here, there are a couple of news outlets that do a lot talking about like what's happening with the law, what's happening in policy. Um, I use Politico a lot, even though I don't always agree with like sort of their editorial bias. But I also think there are for disability specific work, Disability Scoop does some good work. I think the best thing I can suggest is getting a pretty good broad sample. Oh, Kaiser Family Foundation is not always the most accessible, but they do really, really good health reporting. So I think that's the other one I would really recommend for if you're following disability work. And then, I mean, you can follow us. We share links to sources we trust. There's a number of other organizations that we work with, National Health Law um, Project, the DREDF. They also put out, again, not always the most accessible. This is something that we try to support them on, but those can be really good sources for what's happening that can affect us. So.
Thank you. And then someone said, can you share the list of what makes a setting an institution from the settings rule? Um, I can
Sure.
I can
Oh,
also share in the chat the link to our HCBS settings rule page that has a few resources, including how can I find what rights I have under the HCBS settings rule, which includes the list of those specific rights. But I will let you answer.
thank you. I was actually going to suggest that because I did kind of a brief overview. That's not an exhaustive list. We go into it more in that toolkit, and I think that includes sort of the full list. But the rule basically says that there are you have certain rights if you are in a setting that is controlled by the provider for it to be a community-based setting. So those rights include the ability to have a guest over, including overnight. You can have someone stay overnight with you. You can have someone, you can choose to go out when you want to. You can set your own schedule. You can um, eat when you want. You have access to the food in your home. That's something we call the burrito test is if you wanted to, could you get up in the middle of the night and have a burrito because you want to. So do you have the ability to privacy? Do you have the ability to lock your door? So those are sort of some of the rules. That isn't a full list, but the toolkit does have more there. Um, there are some exceptions to some of the parts of it, but those have to be very specific and like in your service plan that it says for these reasons, for this very specific set of circumstances, maybe there's a limit here, but that's has to be spelled out in your service plan. You have to have the ability to challenge it. And those are also parts of the settings rule. So some of them are also not negotiable. Like you're supposed to be free from restraint and seclusion. Um, they can't limit your movement. They can't um, again with some very specific this is in your service plan and challengeable and I think in the case of restraint and exclusion has to be very time limited and documented and reported as well but they try to be there has been a lot of debate on this and this is something that we continue to advocate on because I think there's also a need to like both recognize that people's needs are a little different across the board but that we also really don't want to see settings that are doing this to people as a matter of course because that's an institution even if it could be a single room a single apartment or single room but if they are controlling your actions if they're controlling your ability to come and go it's still an institution even if you're living in an apartment by yourself, if you don't control your activities. Um, yeah.
Thank you. Next question. How could this affect people getting Section 8 housing on the basis of disability and prior homelessness?
Okay. I'm glad you asked this question because this is something we didn't talk about too much in this presentation. But the same budget bill, the budget reconciliation bill, that is, um, sorry, no, the not the word, the president's proposed bill for 2026 does include very, very big cuts to Section 8 that they're proposing. They're proposing eliminating a lot of the programs that are specific to people with disabilities. So there are what are known as mainstream vouchers that are part of Section 8. This is a program within Section 8 that's really there to um, keep people from being institutionalized. It is supposed to be for people who are at risk of being institutionalized or are leaving institutions. Um, they want to get rid of those vouchers and basically put it all in one slush fund that they give to the states to figure out who they give it to. So um, that's another very concerning thing that's happening. That's the president's budget. It's different from the budget reconciliation that's attacking Medicaid. But we are very, very concerned if we start to see Congress or the Senate try to do the things that the president is asking them to do with the budget for next year. We are going to want to make sure we're making noise about that. In normal years, the president asks for something, and that doesn't mean Congress does it. I don't, we are still trying to figure out if that's what's going to happen this time. And when we know, we are going to be making noise. So please watch this space. We will be sure to let you know what's happening there. But we do know that there's a lot of interest in some pretty big cuts to Section 8. If not Section 8, then to other housing programs that people with disabilities rely on. And we're preparing to fight that. I think we're part of a coalition called the Consortium for Constituents with Disabilities. A lot of disability-specific housing work happens there. There's also the National Low Income Housing Coalition. They also put out a lot of good work on housing. So I would say follow them for more information on what's happening with the budgets. I will put that link in the chat as well.
Thank you. And then someone said, the attack on trans rights and disability rights are so intertwined, yet many spaces are divided in their efforts. Is there a way to fight for both that doesn't feel like constantly splitting effort?
That is, yeah. So I think this is very tricky, and I think this is something where I want to acknowledge that I think there are people who see attacking trans people as a political winner for them. And it has made how we advocate here a little challenging because there's this thing where if you call more attention to things that those folks want to do to harm people, it may make them more energized and more eager to do it. So as a disability org, we also really take our lead from the trans community here. I think we want to make sure that we're working together, that we're supporting each other, that we're not harming each other's work. I think the 504 thing is a really great example where like they want to say that this is about harming trans people, the people who are suing. They don't want to say this is about harming disabled people. Now, that doesn't mean it's not very serious and very dangerous that they're trying to harm trans people. I don't want to downplay the threat. I think it is a real serious thing. I think on a personal level, I think the attack on trans people is the real reason for that lawsuit. Um, at the same time, um, does saying that help us, or does it make the people who are trying to harm trans people even more eager to do it? So I think that's something we pay a lot of attention to the trans community to make sure we get right, because we definitely don't want to hurt. We, as you said, we're very, very intertwined. A lot of the autistic community is trans. We've seen attacks on the trans community use disability as a reason to attack or undermine trans care, or to say that autistic people can't self-determine. I really want to make sure that we are getting this right and that we are not harming either of our causes. So for me, it's really important that we work together, just on a fundamental basis.
Absolutely. Also, some folks wanted to shout out as far as disability news, Adapt and Julia Mitro's reporting at Mother Jones.
Mhm.
Julia's work is fantastic. Um, Someone asked, how do you suggest disabled people to continue advocating when they're limited physically, mentally, temporarily, etc.? I find that with my chronic illness, it can be difficult to get all these tasks done timely and or sufficiently.
Yeah, I think that is a challenge. And I think, I think it's very, that's one reason I think we do say it, there's power in numbers. There's also support in numbers. If you can find local self-advocacy groups, that can lessen the load a bit, and find what works for you. I think we try to create tools that make it easier for people to engage. We try to give resources that make sort of lower the barrier for people who are trying to contact legislators or trying to submit comments. We do, we try our best to really give folks the tools to make sure that that they can do that advocacy as much as they're able to. I think it's also, I think, important to have a good idea of like what sufficient means because it is a little different in every place. When you're submitting public comments, there are times where like it doesn't have to be a very big thing, where you can just say, "This is who I am. This is how this affects me, and this is why it matters to me." And there are times where that's enough. Just adding your voice, telling as much of your story as you can, but it doesn't need to necessarily be a big production. I know that we tend to be a little long-winded in some of our statements, but not everybody needs to do that. So I think just finding what works for you, what you're able to do, and if you can find the supports to sort of um, pick up your work and uh, carry it forward, that can be really helpful too.
Right? Uh, Someone suggested in Tennessee, we have a great resource. I suspect many states have similar organizations. The Tennessee Justice Center does weekly updates.
Mhm.
I think even in response to that last question, I would recommend finding local organizations or groups. It doesn't have to be, a formal organization necessarily. It can just be folks who do good work in your community. Um, you can look for self-advocacy groups near you. You can look for ASA and affiliates. You can look for folks doing uh, advocacy work in different areas because often coalition building is a big part of all of the work. So you will most likely overlap with other work you want to do. Um,
I'll also add, because I think we kind of get stuck in the professional space here. Talk to your family and friends. Like I talked to my friends in Pennsylvania about the Medicaid budget because they have a senator that is important to reach out to. Um, so yeah, you can talk to your friends, you can talk to your family. Having them do some of this work too is important too. Anything you do to spread the word and let people know why this matters. Um, yeah.
Definitely, yeah. Every little bit adds to it. You don't have to do every bit. Uh, uh, just a kind message, but someone said this is the best webinar I've watched in a long time. Your explanations were so clear and concise. Will this be made available by recording or slides for us to share later? Yes, we will be posting this to our YouTube channel later this week, and we will make sure to send the slides to attendees this week as well. Um, Someone asked, can seniors and people with disabilities file for a state fair hearing with cut, reduce, or elimination of IHSS in California or nationally to remain in their homes? I'm a former advocate in helping seniors and people with disabilities. These cuts will cause children and people with disabilities to die without Medicaid.
So I'm gonna admit to my limits here. As far as the individual state process for filing appeals or for your hearings. Those do vary a lot by state by state. I would recommend working, if you are exploring that, I would recommend talking to your Centers for Independent Living and to your protection and advocacy organizations. I'll admit that is a little bit out of my depth, so I can't really speak to how um, you know how much you can accomplish through that. I think where there are cases where if you are denied services that you are entitled to, that may be a process available to you. It's just a little bit out of my expertise, so I don't want to say anything that's untrue or incorrect or misleading. So I will encourage you for that to really reach out to your state centers. They do like those organizations, protection and advocacy, the SILs, those are really there to provide those sorts of support and to really help you through that process. So I would really encourage reaching out to them if that's something you want to explore.
So, and then someone mentioned they can see people pitting autistic folks against each other using functioning labels, using the profound,
Mhm.
severe categories, quote unquote categories. How can we prevent these kinds of splits?
So I think there's a couple of really important things here. One is, I mean, I think one thing is to make sure that we are being inclusive, recognizing that we are as an autistic community, we do have a range of support needs, a range of expressions, making sure that folks with more significant support needs are included, are part of the conversation, that we're doing what we can to include folks is a really important part of this, making sure that people who have significant support needs have the support they need to advocate, I think is a really important part of that. I think also that sort of effort to split people by functional labels, I think it's important to recognize that that leaves all of us worse off, like people with significant, a lot of the rhetoric around people with significant support needs is sort of aimed at pushing this idea that like some people don't have support needs that um, that allow them to live in the community, which again we think isn't true. We think that with the right supports, anyone can live in the community, that they don't need to be institutionalized. But I think a lot of times the rhetoric around significant support needs sort of is aimed at suggesting that people with significant support needs should be institutionalized, and that's just not true. Um, at the same time, we also know that that's going to leave a lot of other people who may not visibly have those same support needs without any supports at all. And I think it's important to know that those range of support needs, not only across our community, but within individual people, don't always look the same. That there are people who may have more significant support needs that um, don't manifest in a way that may be immediately visible, but are still mean those supports are really important for us to live and work and stay in the community. And that it's just as important that we have those. I do think that you do see a lot of this rhetoric, though, around things like the cuts to Medicaid that are being threatened. This idea that like they want to protect the most vulnerable, but able-bodied people are, shouldn't be getting Medicaid at all. So I think recognizing when they're using language like that to pit people against each other, and recognize that like one thing we're saying about the Medicaid fight is all of these things are cuts. All cuts hurt us. Every part of like there's no part of people, no group of people who get Medicaid that don't include us. And the things that they're trying to do are going to make it harder for us to get the care and services we need. So, um, I mean, we can say it's just a lie that they're doing anything to protect Medicaid for us, and that we need to just be very clear on that. I think that's ultimately um, the best we can do there.
Thank you so much. And if folks have other questions, feel free to put them in the chat. I will give folks just a minute. Otherwise, we will wrap up. All right. Thank you everyone so much for coming. Thank you, Greg, for your time. I think this was really helpful. Again, we will post this onto our YouTube channel this week and send the slides to folks. But I want to thank you again for coming and being a part of this important conversation. Y'all have a great day.
Thank you for joining.